with all this change, I am so excited to be here to talk to you about the transition into motherhood. It is something I am personally so passionate about, and I just love my job. Obviously involves a lot of journeying with women into the transition of motherhood, and it's something I am so passionate about, not just because it's wonderful, but because of the challenges that come up. And I think like so many people have mentioned already, you know, the support needs to be there, and it's a big change, and we're going to have a little look at that. And what's with all this change? It was a perfect title, because I think that's literally what every woman says who I encounter, I treat, whether it's antenatally or postnatally. It's what's with all this change. So we're going to have a little look at that with the transition. So I don't need to introduce myself because Suzanne already did a lovely job, but I am just, women's health is my passion. I absolutely live and breathe it. I love it. I've obviously had experience in both NHS and private, but I'm doing a big leap of faith and deciding to open up my own private practice, which will be opening in July. So I'm very excited for that, and you can stay tuned for my website and things like that. The transition to motherhood, first few things I wanted to mention about this, guys, is it's so individual. It is so individual. It is as unique and as diverse as the woman transitioning. It really is. And and I have to mention that because we have such a social construct for motherhood in society today. We really do. And this social construct is this kind of box that we put motherhood into. And it's not great because it doesn't allow any flexibility, fluidity for anyone that box doesn't really fit to. And what ends up happening is we're all scrambling trying to get into this box, and it doesn't really work. And we have this picturesque perfect motherhood, which is part of this construct, and it really doesn't exist. It really doesn't. And there's a lot of social media at the minute going on, which is great about how we need to get rid of that perfect motherhood, because it doesn't exist, and a lot of mothers are struggling trying to achieve it. So, you know, acknowledging that is a big step. We need to name these things and dismantle them, which is really important. It's non-prescriptive. There is no format. There is no set format and no set protocols for motherhood. It is so unique and it's so individual, and your motherhood will be totally different to mine. And I rarely give answers or advice when it comes to motherhood to anyone that I'm working with, because really it's about empowering women to make choices for themselves. You know, what my choice was would not be another woman's choice, and it's actually not about standardizing motherhood. It's about saying, well, what's right for you? What do you feel? You know, that's an interesting question. Let's look at that. You know, it's because it is really so unique. And it's difficult. It really is. And this isn't to scare anybody or anything. This is just to acknowledge and validate that when we have hard days, and when, you know, it's not to say we've done anything wrong, you know, it's the fact that that is part of the process, and that we do have difficult days, but that we're all in it, you know, we're all in that together. And that's not that you're doing anything wrong. It's that it's the essence of change. Any transition that is change, you know, it can be tricky. So just to name a few, I could literally talk about this for hours. There's so much, and again, because it's so individual, people's challenges in this transition will be different. So I wanted to try and think of universal challenges, really, and for me, that involves the changes. You know, we talked so much about the changes that happen in our bodies, and I want to talk about one in particular within our brain. So I'm a little bit obsessed with neurobiology, and there's actually amazing changes that go on within our brain that I wanted to talk about. Because when we have a knowledge, when we have that understanding, it does help us, helps us part of the jigsaw of navigating through change. I want to talk about emotions, and I want to talk about nourishment. And for me, because to me, my kind of theory, if you like, with transition and motherhood is all about adapting, attunement, and attentiveness. Again, it's not protocol or prescription. It's actually more about, you know, adapting to changes, attuning to your inner experiences, your lived experience, which is different to everybody else's. And it's attentiveness. So it's really attuning to being attentive to what your needs are, what's going on within your life, and how you're navigating through the transition. So, oh, you can't really see that properly because my thing is covering it. But oh, there we go. That might have changed view, I don't know. Pruning, so you might have heard of it. So I'm going to talk about one of the big changes that happens when we become mummies. So pruning, you might have heard of that, but actually the side term for it is matrescence. So this describes this transitional period of motherhood. So research by Elsleen Hoxema, sorry if I've butchered her surname, and her team in 2016, they did fascinating research, and they found that the female brain actually undergoes complete remodeling. So the whole entire brain resculpts itself. It's called brain resculpting. And it's like a massive neural remodeling. So your actual brain matter like physically changes. And that's amazing. And they've noticed these changes start from first trimester onwards. So, you know, that point when you realize you're pregnant and you're like, everything's changing. It really is, even from a brain point of view. And these changes are so drastic. They've actually recognized them to be very similar to adolescent brain, except it happens in about 9 months' time, in a period of 9 months. But they're so widespread and they're so specific, these complete neural changes in our brain, that they can identify on an MRI scan a woman who's a mother and a woman who's not a mother. So this is really, really interesting. And I just find this absolutely mind-blowing, which is why I'm sharing it. So what are these changes? I'll move this up there. My camera. So what are these changes? So there's brain activity and sensitivity in areas linked to risk perception and reactivity in the brain. So basically these are the areas of the brain where they have the fight and flight processes in. So I don't know if any of you have heard the fight and flight processes. And basically that is responsible for, am I safe? Am I in danger? This risk perception. And that gets great, it gets a little bit more sensitive, and it gets more activity within the mother's brain, which is really interesting for us as clinicians, because that helps us understand a little bit how we navigate treatment and approaches to people. But really, as a mother, I found that really fascinating. And again, if you think of our primary role as mothers is to keep our baby alive, isn't it? So actually, that's wonderful. And that's evolution doing a fantastic thing to prepare us for keeping a child alive. And also you get noticeable changes in areas of the brain, such as the prefrontal cortex and parietal lobes, which are linked to social cognition and theory of mind. So lots of words you don't need to understand, but basically your prefrontal cortex is the area of your brain that is it's kind of like the decision-making area of your brain. So it receives information from everywhere, memory, emotion, external, and it makes decisions. So basically this upskills. So you basically get better at making decisions, believe it or not, even though we, we're always tired as moms, but we basically upskill in how we respond to cues, which is what we particularly noticed in functional MRIs. And in particular, we upskill in the sense of keeping in tune with cues. So they noticed it was particularly upskilling in the way we keep in tune with emotional cues, which I think is really interesting, because again, our second primary role as mothers is to keep in tune with our baby's needs. So again, this is like really, really incredible. You talk about the female body, it's just incredible. And I always say it's pretty impressive, and it completely debunks this whole idea of baby brain. So this idea of baby brain, that our brains become less functional and we become kind of less able after we've had a baby. Obviously, if we're sleep deprived, that's usually the case. But in terms of actually this research, the knowledge that we've now got from this kind of research suggests that actually we upskill in our neurobiological function. So I think that should go down on a CV after you've had a baby. I've just spent 9 months upskilling my brain. So this is absolutely wonderful, and it's normal, and it's myth debunking, which is great. However, it does create huge changes in the way we feel. And I've just noted, obviously, previous slide, that we can feel a lot of changes very quickly in the way we feel. Maybe, you just got to look at that central sensitizing to understand we will be experiencing a lot of changes internally. We experience huge changes in the way we feel, our emotions, even our sense of selves. This is a huge identity shift, really. Our roles are changing, and actually, again, our roles are changing, and we're under pressure by the pre-written narratives of where our roles are changing too. But actually, it's about having the courage to write your own as well. These things have to be said in this culture where there is just so many pre-written narratives. So that pressure's on, really, a big identity shift. Which brings me on to talking about emotions. This is something I'm really passionate about, and I'm passionate about because I went head first into all the research around this because I was really interested in we really need to reframe the way we look at emotions. So again, talking about social constructs, I like to dismantle things, cause a fuss. But we basically have good emotions and we have bad emotions, and we box those kind of in society. And when we feel good emotions, that's great. We love to kind of roam around in there. And when we feel anything in this bad box, what we've categorized as bad is we've learned in society that those ashamed, we need to be ashamed of those, or there's perhaps lie narratives around them that they'll last forever. Or, we need to get rid of that. Come on, just get over that. And there's lots of reasons why, or they're uncomfortable and they're difficult, and we pack them down. And we know as healthcare professionals that cause all sorts of problems, and from research that causes all sorts of problems. So what we really need to do is break that taboo, really, and actually, because truthfully, again, we've got an amazing research on the forefront of emotion. We've got Dr. Susan David, Brené Brown, and we've got Dr. Caroline Leaf, we've got Kristen Neff, we've got loads. And they're actually saying we are a landscape of emotion. We really are. We have got a landscape of emotion, and we need to just look at the fact that every emotion is beautiful and is normal. And actually, it's about recognizing we are not our feelings, we are beings that feel. And actually, emotions can be part of the healthy human experience. And it's about being able to have the courage to lean into those emotions a little bit and think, okay, well, what are they telling us? Because actually, emotions can be a great way, it can be a form of information into our values, into our morals, into our story. Into our needs. It's about thinking, okay, I'm feeling this way. What's that telling me about my needs? What's that telling me about X, Y, and Z? Again, sorry if you can't see this because my head's in the way. I don't know if it's the same for everybody else watching. But emotional flexibility, again, emotional flexibility is a concept put up by Susan David, Dr. Susan David, who's a psychologist at Harvard University. Emotional flexibility is the name of her book. So I've taken this a lot from her work. I've also put my own little stamp, just kind of interpretation from what I see clinically, because I'm not a therapist, but I adopt very much a kind of coaching framework, or a slightly kind of mind-informed framework into my practice, because I'm really passionate about a whole person approach. I don't just treat a stress incontinence. I treat a mother who's postnatally, who has had a tough birth, or who's at home with kids, or is about to go back to work with stress incontinence. It's really, really important for me that that's my approach. So for me, to just create a culture where we can be more emotionally flexible is first identifying emotion. Okay, this is often the hardest thing, but really it's liberating to be able to create the skill where we can identify our emotions is really, really powerful, because that's often if we can identify, it's about getting real with how we feel. And it's about being real with our experience. And that in itself is quite powerful. And often, again, the emotional specialists at the forefront of research say that if we can do that and lean into them a little bit, we often ourselves have the solution to the emotion ourselves, which is crazy, because we live in a society where we just kind of run away from them a little bit. So identifying, again, this is my absolutely favorite thing in the world, which is an emotion wheel. I'm going to move this over here. So I don't know if you've seen it before. It was developed by a psychologist, Robert Plutchkin, and he basically outlines the 8 basic emotions, and it helps us to identify and come to terms with how we feel. This can be amazing. Again, this is just about creating skills within us that help us take care of ourselves. It really is. Again, I have, obviously, when I'm talking about emotion, if you do feel emotions that are so overwhelming they're affecting your daily life, it's important you seek professional help from a therapist or a counsellor. And I would obviously do the same if my patient was, I was picking up that was what was going on. But a lot of this that I'm talking about can just be adopted in our day-to-day life and cultivate much more self-awareness and self-management. And a much healthier way of taking care of the self. It just breeds a lot of self-awareness, which is wonderful, allows us to grow and flourish. So yes, this emotional wheel, I've got it here. I use this all the time in clinical practice. It's amazing. Because again, I could just have, for instance, a postnatal woman who's just, they often say, I feel so emotional, overwhelmed, and often, I'll say, okay, I'll fill out my emotion wheel, and they may just be having a tough morning, but actually sometimes they just need to identify something and think, actually, you know what, that's what I'm feeling. And and literally you can go from here to here to just like with identifying something. It's something I use. It's amazing. I often use it because, again, as a society, we haven't normalized identifying how we feel with the spectrum of all the emotions and recognizing that they're all okay and they're all just telling us something. So then my second thing is get curious. Okay, that's interesting. I'm feeling a bit irritated. I wonder where that's coming from. From a place of compassion and non-judgmentalness. Because we are really hard on ourselves. Literally, again, we are the most uncompassionate selves to ourselves. And we really have to try and read, it's hard, but really try and create a little bit more self-compassion for ourselves. If you wrote down in a day what you said to yourself, you'd be quite shocked. And again, the research is there, very clear that we need to do a little bit more work on getting compassionate with ourselves. So just, it can be as simple as, okay, I'm feeling angry, that's interesting, I wonder where that's coming from. You know, I'm angry, as opposed to, I'm angry, I shouldn't be angry. Why am I angry? I should be lucky I'm pregnant. You know, things like that. That's toxic positivity. You've got to be careful not to fall into that. And then make space. So again, you might just want to spend some time, you know, go for a walk. It's about making space if you need to for that emotion, just to process it. You know, you may feel like identifying it is enough. Or you can do some writing exercises, journal, maybe you want to start some mindfulness, or maybe you just want to have a chat. You know, a lot of my patients are like, you know what, I think I need to go home and have a chat with my partner, or who you web support. You know, again, what I know Dr. Liz said this morning, web support's really important, because pregnancy and postnatal is an emotional roller coaster. You know, I feel like I went around this wheel like 5 times a day in an hour, you know. So it just helps. And then basically from that, you cultivate a trusting relationship with yourself where you're more in tune with what's going on within you. And that's just beautiful, really, because that's honestly what we need more of. Again, because this isn't saying it's going to make, you know, motherhood any less chaotic. It is by nature, you know, rupture and repair, chaos and beautiful, and it's learning and unlearning and relearning. But what we're saying is that this can be a real opportunity to kind of grow with it and self-develop and just stay attuned to yourself, and to make sure our sense of self doesn't collapse, because that's what, you know, can often happen. It's about recognizing we're still a person, you know, and it's just because emotions come up in phases of change, and that's normal. Again, it's really, really normal. Then hopefully you can take any message, it's just that it's all normal. Mind the motherhood gap is something I just wanted to touch on as well, because this is trending around social media, and it's just about what I said earlier about this picturesque, about this this parent trap that we're living in, and actually we need to end this perfect mother scenario. This picturesque image doesn't exist, guys. It really doesn't. In fact, I'll go as far to say it's not all instinctual. It really isn't. But we learn, we feel, and we navigate our way through it. We really do. And that's just to not put pressure on. It's about leaning in and saying, you know, we're not subject to forms that don't suit. You don't have to be subject to forms that don't suit, really, and recognizing, okay, well, that is just a construct. That's not something I have to aim for. And honestly, it's just presence, not perfection. It really is. I'm sure any other mother would agree. It's you know, if there's anything, it's just that. It's just presence. It's, you know. The last thing I want to mention before I just quickly talk about my project is Nourishment. Again, I'm just going to move myself because on my camera, there we go. A shift in language can create such a different frame, right? Okay, so basically self-care is a billion-dollar industry. It's massive. And which is great because it's made people more aware of how they take care of themselves, which is fantastic, and it's done wonders for pelvic health. And people coming to us to take care of their bodies. But however, you can pretty much put anything into this pocket of self-care. And I think sometimes it just gets a little bit confusing what we're doing self-care for, what we are doing. And ultimately, to me, it's about nourishing the self. And I started to change my shift in language because I started to recognize self-care wasn't really doing it for somebody. So I don't know, I might say to a patient, okay, tell me what you're doing for self-care. And they might say, I'm doing this, this, and this. And then I say, okay, what are you doing to nourish yourself? And they're literally like, nourish myself. It's an interesting question. I don't really think it nourishes me, no. So it's so interesting. So I just started to ask it all the time, and it challenged me a lot, and it challenges women, because actually that's what self-care should be. It should be, what are you doing to nourish yourself is a big question, a big challenge. You know, if you had to spend 10 minutes nourishing yourself, what would that look like? You know, explore with it and challenge yourself in that language, because it's about recognizing that you still exist. you as a mother still exist, and you still have a sense of self, and you know, and you're allowed to still invest time into that. And really, we live in this big ecosystem. We as humans, we've got these multi-systems that, you know, respond and interact with each other. And we nourish children, we're nourishing our children, we're nurturing them. Really, we need that nourishment as well, you know, like an ecosystem, we need that nourishment as well. So it is really important, is we're pregnant or if we're in motherhood, you know, what would that look like, and what would that require just to get a little bit of nourishment.